what TracFone does under this program is provide the actual cell phone to a user, and about an average of 70 minutes a month you would get if you qualify for this service. And you could take that phone and put it in your pocket, put it in your car, put it in your purse, and you bring it with you and use it as your phone is mobile with you. And the Federal Communications Commission approved TracFone as a provider of these Lifeline services. TracFone's program is called SafeLink, and with the endorsement of the Grange, a resolution that you all passed in 2007, it calls on the Federal Communications Commission to approve TracFone to be able to provide these services. They did that. TracFone then needs to go into each and every state where it wants to provide the service and seek their approval to do the same. We are hoping that we can bring the numbers up. Right now, of the 21 million Americans that qualify for Lifeline services, only about 6 million take advantage of it. And there are a lot of reasons that they don't. And we're hoping that with the kind of services that we're providing, more and more people will take advantage. They'll get themselves some communications and telecommunications capability so that they can be connected to the world, I guess as it is. And I know your focus coming here to Washington is on looking to the U.S. Congress. I think you're all going up to the Hill tomorrow for meetings and talking about issues that concern you. And I'm here today bringing this back, frankly, to the state level because we have to go before the state public utility commissions. In some states, we've already been approved to provide these services. Just last week, in fact, Texas said yes to it. Earlier this month, North Carolina said yes. Connecticut has approved it. New Hampshire has approved it. Massachusetts has approved it. But in other states, we're still waiting for approval from the Public Utility Commission. In Ohio, for example, we're still waiting for it. In New Jersey, we're waiting for it. I have the list here of states, and I have a packet here that I'll provide to you. California, South Carolina, Washington State, and Wisconsin, where we have applications pending so that we can provide this service to people in the state who qualify for it. And Leroy just asked me to come by and talk about it. I'll pass out some materials, including your resolution, a sample letter, and if you represent any of those states and you're so willing to go back and talk to the folks back home, we have a number of organizations representing seniors and consumers, in addition to rural consumers, who are working on getting this approval at the state level. I don't know if anyone has any questions about it. It's pretty straightforward. Like I say, unlike healthcare with lots of big issues and lots of things that need to be decided, here's one that is a relatively straightforward issue with what we think is a simple solution to help keep people connected.
I'm Mike Clean. I'm with the California State Grange. We'd be happy to help you help out this in any way we can.
Terrific. I have here that I will pass out a packet, and it has a sample letter, and then attached to it is in each state where that letter would go. So I'll pass these out to folks, and that would be great. I appreciate it. Yeah.
Maureen, you talked about how many people are potentially eligible for assistance under the Universal Service Funds and how many are actually having assistance. If this wireless Lifeline program was rolled out in all the states that it is currently trying to be rolled out into, how many people would be eligible? Do you have a rough idea of how many people would be eligible for this service in those service areas?
Well, we do. We have a state-by-state chart that I think is in here that breaks down for you how many people in a state are eligible for the Lifeline program and how many participate on an average basis. So they, fewer than 10%. You can see here that a number of states with large rural communities have have very relatively low participation rate. What TracPhone is doing is, under the Federal Communications Commission program, you have some required advertising you have to do to reach out to folks to let them know about it. But we're also going beyond that, and we want to team up with organizations. For example, we would work with the Grange so that you could get notification out to your members that lets them know, here's how you qualify, here's what the criteria is, and here's a way you can apply and get yourself this service. I mean, one thing that we think has happened is that there's been very little outreach to the people who qualify for this service to help get it to them. There's been really not a whole lot of incentive to let people know that this is something that they can get. And we want to help remedy that situation by partnering with organizations like the Grange, seeing what we can give you to help you reach out to your members to let them know about it.
Who qualifies?
Right now, it is the qualification, I believe, is if you qualify for food stamps. There are a number of programs, of government assistance programs that qualify you. And what is used here as an example is if you qualify for the government assistance of food stamps. And so I assume that there is an income level associated with that, and I'm not 100% sure what that is, but I know that that is the kind of common barometer that they use. Yes?
Do you face any opposition in these states when it's not yet approved?
Well, we don't face opposition. We're not quite sure what has held up the approval in some states. I assume that there are some wireline carriers who would prefer not to have competition that comes in the form of wireless. In other cases, they want to make sure that the phones are 911 compliant, for example, to make sure that you can have that safety function, and so you provide the phone with them and make sure that they can do it. In other cases, it's just sort of bureaucratic inertia, and sometimes hearing from folks who would benefit from the program is a help to get them moving and get them going on it. All right, well, I'll pass out this information and